Let's talk about something that's not just revolutionary, it's efficient. Regenerative medicine isn't just the future of healthcare, it's the antidote to a broken system. And the reason is simple. It brings healing back to the source, your own biology. Modern medicine, for all its technology and expertise, has a core flaw. It's obsessed with managing symptoms. Are you in pain? Block the signal. Hormones off? Replace them. Inflammation? Suppress it. We're not healing. We're chemically babysitting dysfunction. And the cost? Astronomical. Not just in dollars, but in time, trust, and quality of life. A quarter of healthcare spending goes to paperwork and insurance bureaucracy. You've got synthetic drugs being manufactured overseas, shipped around the world, advertised for problems they barely solve, and then thrown away. And the patient, still in pain, still sick, still dependent. This is not efficient medicine. This is a waste on every level. Insurance requires layers of approval, delays, denials, and appeals. Pharmaceuticals operate through a massive global supply chain just to deliver a pill that masks a symptom. Meanwhile, the patient spends hours commuting to appointments, filling out forms, managing side effects, and getting nowhere. This isn't healthcare, it's a treadmill. But what if we could work with your body rather than around it? That's what regenerative medicine does. Using your own blood, bone marrow, or stem cells, we can stimulate healing. Not just patching, we're rebuilding. And when you pair that with functional medicine, you start treating the soil, not just the seed. You optimize hormones, you reduce inflammation, you boost mitochondrial energy, you fix the terrain. Now you're creating the conditions for real recovery. Here's the beauty of it. The patient becomes the hero of their own healing. They're not just swallowing pills, they're watching their body respond to itself. They see their own platelets injected into a damaged joint, and over the following weeks, the pain fades and strength returns. They sleep better, they eat better, they move better. They believe again in their own ability to recover. That's not just medicine, that's empowerment. And for us, the doctors, we get to practice real medicine again. We're not reduced to glorified prescription pads for big pharma. We're using our hands, our judgment, and our skills. We're using ultrasound image guidance and biology. We're not just pushing papers and checking boxes. We're getting results, and we're doing it independently. This is meaningful work. Regenerative medicine is high-value care. It bypasses the middleman, cuts the red tape, and eliminates waste. We're optimizing healing per dollar, per visit, and per treatment. Less dependence, more outcomes. That's efficient medicine. But let's be clear, regeneration is not a passive process. You can't inject your way out of dysfunction. The body is a biologic machine. Joints, fascia, and nerves work together as a system. And if one part is out of sync, the whole thing breaks down. So we train posture, we restore strength, we reprogram movement, because when a patient regains muscle, motor control, and resilience, that's not just symptom relief, that's proof that regeneration is happening. Muscle is medicine, strength is evidence, and movement is therapy. Functional medicine is the foundation, because without it, regenerative medicine doesn't stick. Why? Because regrowing tissue takes fuel, hormones, and a balanced system. We optimize sex hormones, thyroid, mitochondria, we regulate vagal tone, sleep quality, nutrient levels. If you want the engine to rebuild itself, you have to support the factory that makes the parts. Cortisone injections and anti-inflammatory drugs, or PRP and strength training. You decide. Rotator cuff tears, 6 months of surgery and downtime, maybe more, or ultrasound-guided stem cell injections and rehab. Pelvic pain and neuropathy, gabapentin and trial and error, or functional medicine plus image-guided nerve injections. These aren't just alternatives, these are upgrades. Right now, we're standing at a crossroads. Patients are demanding value. Doctors are exhausted by bureaucracy. And the most important tool in modern medicine, your own biology, is sitting right there waiting to be used. It's time for a shift, from outsourcing to resourcing, from synthetic control to internal regeneration. The body isn't broken, it's waiting to be supported. Regenerative medicine is efficient, it's intelligent, it's empowering, and it's the future we're building together.